Let's look at Fortis Healthcare. Now, they declared their numbers earlier. Overall, at an EBITDA level, there has been a great growth. However, at the PAT level, I think there has been a decline. The management is now joining us, Mr. Bhavdeep Singh, CEO at Fortis Healthcare. Sir, thank you so much for taking out time for us. Could you tell us about the operational numbers? What has been the growth in EBITDA, as you called, and is the momentum continuing?
Sure, good afternoon. Thank you very much. We're very encouraged by the quarterly numbers that we've just reported. As you rightly mentioned, our EBITDA number, and EBITDA is merely the differential between our EBITDA versus our trust cost. And so operating EBITDA, which is the measure of how we're running the business, has done exceptionally well. We've gone for the hospital business. We're reporting an EBITDA of 164 crore, which is a record number for us, and very, very indicative of a solid performance. Similarly, the pathology business has recorded a margin of about 24% and also done quite well. The PAT number you've just referenced, we had a one-time forex gain last year, 50 crore. If you net that out as a one-time, the PAT performance has actually gone up quite substantially. It's actually gone and almost doubled over the year on year. So we feel very good about the PAT performance. We feel very good about the EBITDA number. The EBITDA number has gone up to 40 crore, also doubled over last year and the preceding quarter. So if you look at the business overall, driven in great part by occupancy, our occupancy numbers for the quarter were well over 80% across most of our hospitals. Whether it's in Calcutta, whether it's in Karnataka and Bangalore, Chennai, Bombay, Rajasthan, Punjab, NCR, across the board, good solid occupancy numbers and a healthy mix from a clinical specialty perspective. So very optimistic, feel very good about where we are, double-digit growth in revenue. And as we've been saying for some time, the business is on a sustainable basis. We see double-digit growth, low double-digit growth going forward. And I think that bodes well. I think it bodes well for our patients. I think it bodes well for the wonderful doctors, nurses we have. And generally, we see more good things coming from Fortis Healthcare and the SRL Diagnostics business.
Right. As far as the operating EBITDA is concerned, if I look at it on a H1 basis, it's almost become 3 times for the hospital business. Can you just tell us that what has changed? It was the previous strategy that we had spoken about, where you would focus on not expanding much but improving operational efficiency. That has led to these numbers?
Yeah, absolutely. I think that our strategy around focusing on India, number one, focusing on our existing hospitals, existing business. So we've really, I think that over the last 2 quarters, as you rightly said, the EBITDA number has gone up quite substantially. We brought some tremendous doctors on board. So we have an existing doctor base that I think is the best in the country. And we've just complemented that with multiple specialties and bringing additional doctors on. I think we've invested in our clinical programs from a technology equipment perspective. We've introduced 2 robots programs in our hospitals. Our transplant program continues to expand and grow. We have the largest cardiac transplant in the country. We have one of the largest liver transplant programs. And so I think all of these things are coming through. And then at the base is good operational effectiveness. And we put a big focus on cost and reducing cost and reducing waste in our system. And I think the entire organization is really energized around doing things effectively, efficiently, do it right, do it once. And I think that's what's contributing to some of the good things we're seeing now.
As far as diagnostic business is concerned, even though that you have demerged it, can you just tell us about the performance? When is the demerger expected to get fully completed?
So the performance continues to do well. We've added 13 labs in the first half of the year. We've added diagnostic centers, and we continue to believe. I mean, the SRL business is the most recognized, most respected diagnostic business in the country. As you've just alluded to, we did announce a demerger, and the demerger process continues. As you can imagine, in a complex situation like this with a listed company and a demerger, there are certain approvals we need from multiple locations. So we're waiting for those things. We're waiting for the approvals to come through. There's an ongoing diligence process that's going on. So I would anticipate that we will see the demerger taking place and completing sometime around the first half of next year.
Right. As far as the diagnostic business is concerned, Q2, of course, is strongest for you, but we also had, a lot of problems in a lot of areas regarding dengue, chikungunya, some of the other epidemics. Did the total number of patients actually increase for you?
Yes, the number of tests continues to go up, and it's an unfortunate thing in our country. We're still challenged with things like dengue. I'm sure that your viewers know that chikungunya was particularly ugly this year, and it was a very bad strain, and really, really sad. I mean, we all have friends or family who suffered from one of these things, and so yeah, it's an unfortunate situation. But by virtue of that, certainly the number of tests we did continues to go up, and I think people rely on SRL. I think it's at times like that people look to SRL. We have diagnostics in the existing Fortis healthcare network. We also do at-home service. We have labs outside of the network as well. So yeah, the number of tests went up. The number of patients whose lives we're able to touch and enrich continues to go up as well.
Right. Can you just tell us about the last 2-3 days and what is happening at the hospital? Just for our viewers, can you just tell us that, with the currency denominations, that demonetization that we are seeing, how are things happening at the hospital?
I have to be honest with you, it's been a bit challenging. This announcement came as a big shock to the entire country, and obviously everybody had only a few hours notice, so it's a challenge. A good chunk of our business is cash business, and when all of a sudden you take denominations out, it becomes very challenging. I think patients who have either insurance or they're paying through some other form of currency, I think it's fine, but for the cash paying patient, it's a challenge. And so we've had lots of people asking questions. We'd like to appeal to the government. I mean, at this stage, public hospitals, government hospitals can continue to accept the currency. Private hospitals cannot. And to be very honest, I mean, listen, healthcare, saving lives, I don't know, there's no line between a public hospital and a private hospital. It's about, we're all trying to save lives, and I would appeal that exception be also considered for the private healthcare system, so we can continue to take care of our patients and continue to save lives and work towards a healthier India. So it's a challenge. There's lots of questions. We put signs up in our hospitals explaining to people that we're merely following the law, but we certainly hope this will pass very quickly and we can get back to taking care of our patients.
But in the long run, do you believe that as we move towards a cashless economy, you think a lot of now hospital bills would also be paid with bank accounts or probably credit cards? Also, we are looking at a lot of mediclaims going up or mediclaim coverage going up. Does that mean that you would start to get a lot of money via cashless, say probably Jan or maybe start of next year?
I don't know. I think it's tough to predict the timeline. The answer to your question is absolutely a resounding yes. We're seeing that, we've seen that all over the world. Even in a place like the US, 20 years ago, 25 years ago, the number of credit card non-cash transactions since subsequent to that has doubled, tripled, quadrupled. We'll see that here as well. And we're seeing that already, by the way, in terms of the number of patients. If you would ask me 10 years ago, the percent of cash business, it might have been 50, 60, 70%. It's certainly lower than that now. So that's the direction we're going to move in. I don't think that's a bad thing. I think we just have to figure out how do we create payment platforms for everyone in India and not just a small number of people. I think it's a good thing. It's not a bad thing at all. But again, I think it has to be done in concert with access and making sure that whether it's you or I or anybody else have access to an electronic payment platform, then I think it works. Now, if it's only limited to a small number of people, that doesn't work. And like anything else in India, it wouldn't be a good thing.
Right. Sir, thank you so much for taking out time for us and explaining us about your numbers. That was the management of Fortis Healthcare, as always, giving out the numbers exactly. First about the hospital division, which did very well, and the diagnostic business where the patients tend to increase. Meanwhile, as we were talking to Fortis, I think there has been a sell-off in the market. It's still